Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyn Lambrecht.
Welcome to Conversations for Health. I'm Evelyn, and today we're talking about solutions to acne, eczema, psoriasis, and hair loss with Dr. DJ Sims. Welcome to the show, DJ.
Thank you, Evelyn. Thanks for having me.
Absolutely. DJ, what is lighting you up this week?
What is lighting me up this week? Well, to be honest, it is the month of both my parents' birthdays. So my mom and dad both share birthdays this month. So it's really good to be in Texas celebrating with them. They're in their 70s and they were my inspiration to go into medicine because they're both nurses. My dad is a CRNA, which is a certified registered nurse anesthetist, and my mom was an RN. And they actually convinced me to go into naturopathic medicine instead of conventional medicine. So yeah, I'm celebrating them this month.
I love that. I always love just learning more about people. And I definitely want to talk about your background and how you ended up then specializing in naturopathic dermatology. So Dr. DeJarra Sims, affectionately known as Dr. DJ, is a distinguished naturopathic doctor and published author. She holds a bachelor's degree in biology from Prairie View A&M University in Texas and a doctorate from Sonoran University of Health Sciences in Phoenix, which you may know by its former name, Southwest College of Naturopathic Medicine. Dr. DJ has a rich academic background, having served as an assistant professor and core faculty at Bastyr University California, here in San Diego, where she taught dermatology and business practices, very important. And she was also an adjunct clinical professor at Sonoran University. She's the founder of the virtual clinic Superhero Skin+Care, where she's dedicated to empowering women to embrace their inner strength and beauty. DJ specializes in treating acne and other skin conditions and is a leader in naturopathic dermatology. She's a renowned keynote speaker at medical conferences and diverse events, including Comic-Con. She has trained in improvisational comedy at the Finest City Improv in San Diego and the Second City in Hollywood. So you'll notice today, DJ has a way of making complex medical information accessible and entertaining. DJ, I remember when you did that Comic-Con presentation, you talked about lotions and potions in popular movies, right?
Yeah, it was actually like potions and magic in like TV, right? So it was beautiful. It was so fun because I got to break down like potions and different herbal remedies that we use like when we see in Harry Potter or like The Witcher, like any kind of potion, anything basically that's on TV and movies that had herbs in it. If I watch it, I'm like, oh my gosh, would that potion actually work in real life? So I broke down those different herbs and told them like, will this potion make you sleepy? Will this potion make you fall in love? What made this author or this director use that? Right. So it was really fun. And
That's
people
so
loved it.
cool.
They loved that. Yeah, it was hilarious to be a doctor at Comic-Con talking about natural medicine.
Very unique. I love it. So I'd love to hear a little bit more. You just mentioned your parents and how they got you into medicine. Why did they tell you to go to naturopathic medicine? And then how did you get so interested in the skin and hair piece?
Oh, those are two great stories. My parents, they were in conventional medicine and they're just like, this is like, we're missing something. My dad had started reading about natural medicine. I had some things like reading about Andrew Weil and different natural MDs who were going into integrative medicine, Deepak Chopra, like all these people that were around they've been around a long time talking about like hey, there's a piece of this that we're missing in medicine. And most of these were MDs, right? And so they were talking about this natural medicine, integrative medicine piece. And my dad was reading all these books, and he had, back in the day, tapes and CDs. And he's like, this is what you need to go into. Like, you can do what you want to do. My parents have always been supportive. They're like, do what you want to do. And I know, because I wanted to be an anesthesiologist and do like my dad and join him in medicine. And he's like, yeah, but that's not where medicine is heading. Like what medicine is heading is into this natural field. And mind you, this is in the 90s. Like this is in the early 90s. And he's like, medicine is heading this way. And you need to be there because this is what we're missing. We're missing this natural piece. And even though there's a long stint in there where I went to DO school for a while, and then I ended up landing in naturopathic medicine, that's a whole nother story. And if you've like listened to some other podcasts I've on, I talked about that. But I ended up in naturopathic medical school in Arizona. And then from there, the piece where I went directly into skincare, it wasn't very instant. I actually was working in pain management. I did a lot of injection therapy. I worked in an inpatient drug rehab on the weekends. And it was there where I saw patients where they were doing these therapies in naturopathic medicine. It was an integrated drug rehab program. And we were doing sauna and acupuncture. And, we're trained in acupuncture at SCNM or Sonoran. And we were doing that and diet. And in 30, 60, 90 days, you saw people that had track marks from heroin use and skin picking marks from meth use and just ruddy, dark skin wrinkles from drinking too much alcohol. And all of this happened. But in 30, 60, 90 days, their skin was turning over. They would have a glow. They would have more energy and they would feel better with these detoxification protocols we were using. And so when I had my very first serious acne patient who had large cysts all over their face and nothing was working in dermatology, they came to me and I was like, you know what? I'm going to try something if you don't mind. You're going to be my miracle patient. I'm going to put these detoxification protocols that I learned in drug rehab. I'm going to use them on you and see what happens. And in 4 months, her skin was completely clear with no medication, no steroid use, no birth control, nothing. And on top of that, this person had a hysterectomy. So they had zero hormones working with, and I didn't use any bioidentical hormones. And we completely cleared her skin. That was my first serious cystic acne case. And because people saw her coming in to see me, and actually it was like an experiment. So she saw me weekly for 4 months. And everyone in the clinic, in the university clinic, saw her and they saw the change. And then doctors start sending patients to me with serious acne that they couldn't fix. And I was like, okay, here we go. This is it. This is because seeing her come in feeling so defeated, not being able to go outside, not being able to do anything but go to work, go home, not even stopping for gas, not liking to go to the grocery store because of her face. And just seeing her change and go from this person who's timid and shy and quiet, but living her life as strongly as she can with huge acne cysts on her face, to blooming into this wonderful person who's full of joy and light and speaking. I wanted to have that feeling forever. So I was like, okay, I'm helping people with skin disorders. And that's the story.
That's amazing. I love that. Thank you so much for sharing. That's just really, really incredible. So today we're talking about naturopathic solutions for acne, eczema, psoriasis, and hair loss, and we'll go through all of those. So from a high level overview, how would you describe your approach? You just mentioned the detoxification part.
Well, my approach is really looking at the root cause. And I know everyone says that now, it's like a buzzword. But when we look at the root cause, what we're doing is saying, okay, it's not just about C. acnes on the face. It's about what causes this overgrowth of bacteria, what causes inflammation in the body and in the skin, and looking at the real root causes, which are hormonal imbalance, gut dysbiosis, and food sensitivities, digestive issues, liver congestion. And to me, that's the high level. It's like what internally is going wrong that is manifesting on the skin. Because people ask me all the time, they're like, oh, you treat skin, so if do I need to see another naturopathic doctor for my food sensitivities? And I'm like, oh, no, I'm sorry, let me like rewind. Like, I treat food sensitivities, food allergies, gut dysbiosis, hormonal imbalance, liver congestion, and everything that leads to skin disorders. When you have a skin issue, it's usually one of those things that have gone so awry. They're so out of balance that it's now manifesting on the skin. And I also do that without flaring the skin. So to me, what makes skin so like intriguing to me is that I have to fix everything on the inside and also not flare the skin while I'm doing it, because you can easily flare a skin disorder while treating any of those things that you're treating on the inside.
Absolutely. And I love that you use that inside out approach. So let's get it a little deeper into acne. What would you say are the top root causes of acne? Like a little more detailed than
A little
what you
more
just said, the
detail. Okay.
hormonal imbalances. Yeah.
So I see it's looking at those things. So hormonal imbalance, but specifically like acne, to me, I see mostly excess androgens in that hormonal imbalance, but I also see other things, and we can talk about that in more detail later. But when I look at the top things, when I look at acne, there's like, what's the top within the top of the categories, right? So within hormonal imbalance, I see mostly androgen excess, right? So that's testosterone, DHEA, um, cortisol, any type of like excess, you're going to see acne. And then in dysbiosis, I see a lot of loss of good bacteria. So it's not necessarily always a bad bacteria that's overgrown in the gut. I'm going to see someone who has low lactobacillus, low bifidobacteria in their gut. So then there's a dysbiosis there. And then, of course, you have food sensitivities, and it's across the board. But I hate to blame it all on gluten and dairy. But at the end of the day, the highest that I see is gluten and dairy sensitivities, but not all the time.
And then what about the liver aspect? What are you looking for there with testing?
Well, with liver, you're not going to necessarily see high liver enzymes in everyone. Like, there are definitely people that come to me and I run basic CBC CMP and they have high liver enzymes, but that's not always the case. Usually it's like a sluggish liver, and you'll generally just support the liver in all cases of acne and eczema and
Right.
psoriasis. They need liver support. Now, you can do testing. I like to do hormone testing. You can look at like genetic testing to see if they have any SNPs or if they have some type of detoxification problem. And that happens a lot, but not all the time. A lot of times people just need liver support because their liver is working 24/7, 365, and people eat bad. People just
Yeah.
eat bad, and they don't rest their liver. They're not doing like those supportive liver things. So I I like to support everyone's liver regardless of if they're high liver enzymes.
I want to talk through some of the categories that you mentioned a little more detail, just with some specific questions. So, for hormones, do you use a Dutch test? Do you use serum testing? What's your preferred method for assessing that?
My preferred method is Dutch testing. I will get serum tests if I just to have a baseline understanding of where they are. But generally the values are so wide that they're not useful. And you have to do the testing at certain times of the month. And people generally just go into their MD and then ask for tests, and they're just like random. I'll ask them where they are in their period, if they remember, and we can see if it's helpful. But a lot of times it's normal, right? That's when someone finds me as a naturopathic doctor, the problem is that everyone is telling them that their labs are normal. They're like, you're normal, you're
Right.
fine, your hormones are fine. And so by the time they come to me, they're like, I know I'm not normal. I'm overweight. I can't lose weight. My skin is bumpy. I'm hot flashing. I don't have a sex drive. They have all of these symptoms of hormonal imbalance, and their serum isn't showing that. So using a Dutch test to me gives me a little bit more control over what's happening. I can see that there are very obvious changes and there's imbalances in their hormones, and it shows all the hormones, and it shows where they are in the process of the metabolic processes. So I can see where the problem is.
Right. And then when you're seeing excess androgens, what are some of the treatment methods that you use in diet, lifestyle, supplementation?
Oh, yes, there's so much. Now, when I look at the diet, I am using their food sensitivity panels and I'm using the gut microbiome test to come up with their diet. I also look at the hormones and see like what is the level in relation to your estrogen and progesterone. So it's not just about do you have high androgens, it's are your androgens normal and your progesterone too low or your estrogen too low? Because we see different manifestations of hormonal imbalance because it's not just about high androgens. Sometimes it's relative to what the other hormones look like in your body. So people can have this acne that concentrates on the jawline and neck, but their androgens are completely normal. But then I look at the estrogen and progesterones. Does that make sense? And see where are
Absolutely.
they?
Yeah.
And so in relation to the estrogen and progesterone, you're going to have a response. So it's not just about getting a random total testosterone in a person or a random DHEAS. So that's why I have to look at a Dutch test because it's going to give me everything.
Right. And it's also going to tell you how the liver is working, right? Or not, how well it's working or not working. Yeah.
Mhm. I had a patient actually recently say, "Oh, I love the Dutch test. It's kind of like a screening test, right? Because it shows you so much." And I'm like, "Actually, yeah, it is kind of like a screening test because I can give a Dutch test and I'm going to see what's going on with the cortisol levels, progesterone, estrogen, all of your androgens, DHEA, and I'm going to have an oat test, like a mini oat in the back. And so it's going to look at nutrient levels as well as the detoxification pathways. And then I can see if I need to further test."
Absolutely. Yeah. Those organic acids tests are important too. And when it comes to the next portion, so the microbiome and the food sensitivities, so
Mhm.
you're doing a stool test on everybody, right? And then tell me a little bit more about your treatment, diet wise and supplement wise.
Oh, that's gonna be so in depth.
Well,
So
it's okay, broad overview. And of course, it's individualized to each patient, right? So,
absolutely, it's
yeah.
absolutely individualized to each patient. So I'm always gonna do a food sensitivity, and I love doing the stool test. And the reason I do both together, and I start there, is because with the foods, I always tell my patients it's like pouring gasoline on the fire. Like you have a fire burning inside of you, and the foods can either put out the fire or it can be like pouring gasoline on the fire. So it's not a food sensitivity is very like what's going on right now. It's not forever. And I want to see what's inflaming you in the moment so I can remove it temporarily. So they're not removing foods forever. These are not food allergies. So when I'm removing the food sensitivities, I want to heal the gut because now we've kind of decreased some of the inflammation going on in the gut and those supplements can get in and do the work. So I'm going to then treat the gut based off of what's going on in the stool test. And that's going to look at the lining. It's going to look at the short chain fatty acids. It's going to look at if there's any overt inflammation, like actual inflammation of the lining, or if it's just dysbiosis causing this disruption in the microbiome. So I love using both of those together, and I can get a lot of skin issues cleared just with food sensitivity testing and gut microbiome testing and stool testing. Does that make sense?
Yeah. What are some of the most surprising foods you've seen on a food sensitivity panel related to skin health?
Spinach, carrots,
Wow.
curcumin, glycyrrhiza, things that actually treat inflammation in the gut. Those are the worst because I'm just like, oh my gosh. I, it's almost the reason, like it's the main reason I do food sensitivity testing first because it helps inform me on what supplements I cannot give a patient, right? Because it's awful to give your patient glycyrrhiza for like 6 to 12 months and they're actually having an IgG reaction to it, right? And you don't know that if you're not testing the foods. And I've done that before. It was a costly mistake. It cost me some months because I pride myself on patients clearing their skin in 4 to 6 months. And I'm just like, I wonder, because I used to blindly treat because I was just like, I know this works. This is a great product. Here you go. This is a great product. Here you go. And then I'm like, well, why isn't this patient getting better when everybody, 90%, 99% of the patients are getting better except for this 1%? And then you do a food sensitivity panel and you're like, oh, it's a supplement I'm giving them. right? Because they're in an allergic state where they're reacting to things, and who knows what supplements they were taking before, but they've developed some type of chronic sensitivity to something. And so I want to remove that. And that informs, well, that's the difference between doing a combination of herbs for healing the gut versus like one amino acid, like L-glutamine, right? And so in those
Right.
people where they're sensitive to everything, I can go to L-glutamine versus doing a combination.
I know that you're a big fan of the combination products because you and I have had this conversation before.
Yeah.
And I love to ask people on our podcast, especially when we're talking about treating the gut, where you start. Do you start with the gut healing, or do you start with killing the bad bacteria, populating the good bacteria? I'm kind of curious on your timeline that
Ooh.
you use to approach gut health, gut treatment.
That's a great question. I used to go right in killing. And I think in most situations, I do a combination of healing and killing at the same time. Like, here's something that's going to support your gut lining, and this is going to kill down the bacteria. Um, the only time I switch that and go in straight to like just giving them great probiotics is they're really low and they're really sensitive. People that are very sensitive, and a lot of skin patients are. I always tell people, like, my skin patients are my sensitive flowers. They're like my delicate little flowers, and they're going to react to a lot of things. And so I will go in with probiotics first in those people who have very low of their beneficial bacteria, because I can kill off everything all day long, but they're not making beneficial bacteria that they need to make the short chain fatty acids, that they need to have the gut lining to be intact. So a lot of times it is more gentle to go in with the good probiotics and the ones they're missing, which is usually like lacto and bifido.
Yeah, thank you for sharing that. And on this podcast, we try not to talk about specific products, but I really want to ask
Okay.
you this question. So I just have to, because you gave me
So
such
can I?
great insight. Well, I'm going to make the decision that yes, we're going to talk about GI Revive for a second because I know you love it and I love it.
I
And you
do.
gave me such a good clinical pearl that I've shared with other practitioners that you use with people. Could you share that?
With GI Revive very specifically, I like to give patients, depending on what's going on. In most
Right.
cases, I'll give them one scoop twice a day. And I tell them until the canister's gone, and then they do a second canister. So it helps them kind of visualize. They're like, okay, when this canister's done, I need to do one more canister. I keep everything very simple for people. I'm like, you're not on there for like 2 or 3 months, 6 months. I'm like, listen, you're going to use this till it's done. And then I want you to get one more canister. And then we're going to switch to L-glutamine. And if they, and this is what's cool about GI Revive, is some people say, but can I stay on it? Like, I feel so good when I'm on it. Can I just stay on it? And I'm like, yeah, you can. Like, I almost switched them to L-glutamine because it's a simpler way to continue to feed the gut, healing the L-glutamine without necessarily, it being as expensive, right? Because people, like, you have to, as a person of color, as someone who treats patients from all different lifestyles, we have to think of the cost of care. And this is about equity and inclusion in medicine, because naturopathic medicine is seen as a more elite medicine a lot of times. So the cost of the prescription is important to me. So a lot of times I'll have people do 2 canisters of GI Revive and then switch them to L-glutamine because it's a little bit more affordable. But because healing is so important to people, they will find a way if it feels good, and they can afford it, they will. And I want them to make that decision, but I also want them to know that I'm not going to let the cost of a supplement stop them from being healed. Like, I'm not going to be the doctor that says, well, if you don't do GI Revive, I can't work with you, because I'm a great doctor and I know how to heal you on a zero budget, and I know how to heal you when you have an unlimited budget. And to me, I feel like that's important to let people know. Like, this is the top. I want you to do this one, but don't worry, because we got options. We got options, and we have L-glutamine as well.
Thank you so much for sharing that. And I feel like there were some great clinical pearls in there about setting expectations as well for patients. I think that's so
Yes.
important. So thank you for sharing that. I'd love to talk about a few other supplements for acne. I'd love to talk about vitamin A specifically and zinc, talking about amounts,
Mm.
because so I actually had acne in high school and in college, and we should talk about the mental emotional impact of it too, right? Because it's just, even
Mhm.
now when I start to break out even a little bit, it's like I freak out. It triggers all those memories, of just feeling so
Yeah.
uncomfortable, not wanting to go to school, and just feeling so incredibly self conscious, right? And so I actually did do Accutane, 2 rounds of it
Oh,
in my
wow.
life. And so I know
Wow.
that high dose vitamin A works for me. So even now it's something that I take. And of course, I wish I'd maybe just taken the high dose supplemental vitamin A and done all of these other
Yeah.
things instead of the Accutane. But yeah, so I
Mhm.
just wanted to bring that up to lead to the vitamin A. Can we talk about that a little more?
Yeah, I love vitamin A. I've actually will, like, preemptively give people vitamin A and zinc when they're dealing with acne while we wait for tests to come back. Because if everyone knows these functional medicine tests are going to take 3 to 4 weeks to come back, and that doesn't mean you just sit on your fingers, twiddling your thumbs, like, well, I guess you'll get better soon. See you in a month. Like, so I give them vitamin A. And a lot of times their skin will clear immediately using vitamin A. Like, retinols work. It's not that I'm anti-retinols. I'm anti-side effects, and I love to use least invasive to most invasive. And so when I talk about healing acne, like, we do need vitamin A, and many people are deficient in vitamin A. They're deficient in zinc, and most of it is because of the dysbiosis that's going on in their gut. A lot of it has to do with not eating vegetables and fruits. And mostly vegetables, because people love fruits, but they don't eat a lot of vegetables, and then they have this dysbiosis going on. So they're not absorbing. So you're already not getting in the amount of nutrients you need. Then you're not absorbing it properly because there's dysbiosis going on in your gut. And so you will lack of nutrients that you need to actually make skin, right? Vitamin A helps with skin turnover. So doing it in high dose is going to help you turn over the skin. That's why when you see people using retinols and retin A and Accutane, their skin is like really, really glassy and red and angry because they're turning the skin over very fast. And that skin is coming up way faster than it naturally should come up. And it's just a little bit more sensitive. You're sensitive to the sun. And so if we use a natural vitamin A, we can get that same effect without all the side effects. However, I still tell people the same. If I'm doing a high dose vitamin A, whether it's natural or not, they're still having to, like, hey, you need to not get pregnant during this time. You need to do two
Yep.
forms of birth control. I hope you understand. You need to understand. You need to verbally tell me you understand that this can cause birth defects, even though it's natural. And so this is something that I've been very diligent about, because I don't want to be the doctor that's just like, natural medicine is better than drugs, and then still have the same side effects. You can, like, any natural medicine can have side effects to it. And like I said, I want the least invasive to the most invasive. It just so happens that using herbs and in the least invasive method works for me. So I don't have to go to the retinols. I don't have to use Accutane, because if any moment I tell patients, you can always go on Accutane. I'm not going to stand in your way. I'm not going to lay down my life in front of you. That's not the hill I want to die on. I want your skin to clear, and you can use whatever you want. However, if you want to work with me, this is the way I do it. And that zinc, same way, it helps with bacteria. It helps to, like, heal the skin. You need zinc for all different kinds of things in your body. So using zinc and vitamin A together, along with a few other things, but that zinc and vitamin A combination, amazing for acne, amazing for eczema, amazing for psoriasis, and I can get it right up front. And you don't have to high dose it all the time. I high dose vitamin A in acne, but not necessarily in the other skin disorders.
When you say a high dose of vitamin A, what are you talking about? What do you recommend to people?
Like the highest is like 200,000 IUs. Now, mind you, most vitamin A you'll see is like 5,000, 10,000 IUs.
Right.
So when you see like a vitamin A capsule, they're like 10,000, and they're like, that's all you need to give. And I'm doing like 200,000 IUs. And so that's a lot of
For how
vitamin A.
long?
And 2 weeks personally, I mean, I have
Okay.
my own
Yeah.
protocols, but I do it for 2 weeks. And then I'm monitoring it. But I also message my patients. So when patients work with me, they direct message me because of the way I set up my virtual practice. So if I put somebody on high dose vitamin A, I'm like, we're going to be on high dose vitamin A for 2 weeks. However, I will say this, because I learned this high dose vitamin A, what I've been doing is because people are so deficient, I've actually started them on lower doses and get great results doing 10,000, right? When I first started my practice, everybody was getting 200 IUs, 200,000 IUs a day for 2 weeks. That was a basic protocol. Easy peasy, your acne's clear. And now people are so deficient, I'm giving them like an ADEK supplement or I'm just giving them like regular vitamin A that just 10,000 IUs and they're just like, "Oh my God, my skin looks amazing." I'm like, "You're that deficient? You're like not eating any vegetables?" Like no proteins, nothing, no fats. Like if people are not eating well and people's guts are unhealthy. So a very regular, if you're afraid of doing high dose vitamin A, don't worry. Start them on any vitamin A. Get them on vitamin A, get them on zinc, and let them be on a low dose daily until you like, I mean, you have 4 weeks until the test comes back. Put them on A and zinc at a very normal level. Then you don't have to worry about signing consent forms and checking in every day to make sure they don't have brain swelling. Like don't put yourself in a position that you're uncomfortable with as a physician. Do what you're comfortable with because at the end of the day, they're going to get better because they're deficient.
Yeah, I definitely don't use that high of a dose. I've done nutrient testing, right, to know that I don't have toxic amounts of vitamin A in my blood.
Hmm.
So I think
Right.
that's important to test as well. And then with the zinc, I think one word of caution when you take those higher amounts is to make sure that you take it with food. Otherwise, you will feel pretty nauseated. And I'm curious,
Yeah.
what's the amount of zinc that you recommend generally?
I don't usually go over 50 milligrams. So
Okay.
usually people are at 20, 15, 30, not very high. People love to come in, like ever since 2020, people are coming in on super high doses of zinc. They've still been taking them for like the past 4 years. So I'm like, why are you taking so much zinc? Have you checked your copper? Like, there's a zinc to copper ratio we have to pay attention to. And they're like, what? And so it's just one of those things where I don't really see a lot of people that aren't taking zinc nowadays. So I'm adding mostly vitamin A and lowering their zinc because
Gotcha.
people are taking zinc every day because they don't want to get sick. So it's a little bit of expectation there of like, hey, it's okay to not use this every day. Like you're fine. Like I'll take care of you if something goes wrong. Like just let me know. I take a lot of people off of supplements that have skin issues because that can congest your liver because everything we take, the liver has to break down. And so that liver piece, when we talk about it's not just supporting the liver, it's actually looking at their supplements. And patients come to me from doctors all over the world, and they are sometimes on 20 supplements, 15 given by the doctor, 5 they've added themselves. And they're like, what's wrong? And then I take them and say, only get on like this, stay on this fish oil and this vitamin A and zinc. And they are on those 3 things and they get better. And they're like, why did my skin clear? I'm like, because your liver is not burdened by the 20 supplements you've been taking. So there's a piece of that has to do with like med management as well with skin.
Right. And let's talk a little bit about the skin microbiome. So we talked about the gut microbiome. What are you doing to address the skin microbiome in acne? Or do you find that it just regulates due to all the other things that you're doing?
Absolutely. I find both happening. With the skin microbiome, I generally don't change people's skin products right away because skin grows from the inside out. Most of the time, I'm not seeing a lot of disruption with their skin. Because, mind you, when people come to find me, they've already changed a lot of things. They're just like,
Right.
I've been gluten free and dairy free for 6 months. I've changed all my skincare products and they're all clean. Like I'm seeing people who've whittled down and they're like the cleanest of the clean. And they're just like, what am I doing wrong? And so I don't necessarily have patients that I have to just completely be like, do you know you need to not use perfumes and in your skincare? They're like so well versed by the time they come to me. Now, when I do meet those patients that I need to clean up their skincare products, it's sometimes a lot of the eczema patients, because they're reacting to the dyes and the perfumes and all the different things that are in skincare products. And so when you're looking at the skin microbiome, you're not just like looking at, well, how do we hold in moisture? It's just depending on what disease you're dealing with, right? So with eczema, that's a barrier issue. So they're losing water. So how can we, keep the water in? How can we, make sure they're getting enough moisture without irritating their damaged skin barrier already? With acne, we're like, how can we moisturize the skin, decrease inflammation, and not clog the pores? So then you're going to use different products for that. And then maintaining the skin's pH, which is like 4.5. It's very acidic, 4.5 to 5.5, something like that. And so we want to make sure we maintain the skin's pH. So when we're looking at products, I'm looking at products from a naturopathic point of view of what are you sensitive to? Let's remove that. And that's going to be different for every person. I mean, you're going to say, well, use clean products, but what does clean mean? Right? There's some big categories of clean, like we don't want glyphosates in it. We don't want like forever chemicals in your products. But at the same time, there is a like, what is this person in front of me sensitive to? And how can I remove that? So that's going to be on an individual basis. So because it's going to be so varied, I always like defer to estheticians a lot of times. I love me some estheticians. I love me a natural esthetician. I'm like, girl, you need to see an esthetician and let her pick some products for your skin that are clean. And then I'm going to evaluate them to make sure that they're not having any other adverse effects based on the food sensitivities, based off the stool testing, like based off of the tests that I run to make sure that it also is aligned with what I need you to have.
Yeah, thank you for that. I want to talk about the food sensitivities one more time just to wrap up the acne piece. I feel like dairy has been somewhat controversial in maybe the conventional medicine world as related to skin health, though it does seem like even in conventional medicine, practitioners are increasingly recognizing the importance of lowering inflammation and that maybe diet does play a role. Can you talk a little bit about the research around acne and dairy?
Yeah, it's been varied and they've gone from being like dairy has nothing to do with it to like, oh my God, dairy and sugar, don't do it. It's like in this profession for almost 20 years. It's interesting to see it come full circle to like, oh, you naturopaths actually did know what you were talking about when you said that it matters what people eat and that probiotics help. Because, dairy is inflammatory, right? It's gonna increase IGF-1. There's like issues with dairy disrupting the microbiome. There's issues with dairy spiking like blood sugar levels. So it's not just about dairy being bad. And that's why I look at food sensitivities because yes, dairy is inflammatory, but so are other foods in the case of each individual person. But broadly, when you look at gluten, when you look at dairy, when you look at like the major players in food sensitivities and food allergies, it's like gluten, dairy, eggs, soy. And most people, if they remove those, can like clear up the majority of skin issues. The problem comes in with all the people who don't have issues with dairy, eat cheese every day, and their skin is amazing. And then my patients are looking like, well, my mom drinks milk every
Right.
morning and she has beautiful skin. What's wrong with me? And then that's when it goes back to the microbiome. And so I think what's going to happen is, the pendulum swung from like dairy doesn't matter to dairy is the devil to like, oh, it's all about the microbiome. So I think that we're going to start seeing more and more research that specifically will show us that everyone's microbiome is different and how we handle food is different. And for every person that doesn't do well on dairy, I could find like 3 people that do great eating cheese and then have a green drink with nothing in it. And it's like spinach and carrots and they completely have an outbreak. And I'm just like, what is happening? And that's what I have to explain to patients. Like I have to explain to patients why their friends eat dairy every day and don't have acne and they have a dairy-free, gluten-free diet and they do have acne. And that's when you have to understand that it's not always dairy, but it probably is dairy. It's like it probably is, but not all the time.
Yeah, that's the beauty of individualized treatment and care, right?
And that's why I love naturopathic medicine.
Yes, absolutely. Let's move on to eczema. So, obviously, you're looking at the same underlying causes. You're looking at food sensitivities, you're looking at liver, you're looking at the microbiome, and you're looking at hormones. What is different about eczema? You mentioned barrier function just a little bit ago.
Yeah. So when you look at the skin barrier, there's a topical barrier dysfunction. So when I am treating someone with eczema, I have to look at the products, right? Because I'm going to have to hold that water in on their skin while we treat the inside because they're losing water and they have like inflammation and their skin is dry. And so I can't ignore the products. With acne, I can say, hey, whatever you're using, if it's not causing you to have worse acne, keep it. Keep using it while we heal the gut. With eczema, I'm like, show me your products. Let's go through
Mm,
those products. Let's clean those up. Let's get you something that you're not going to flare every time you use it because, patients with eczema can get out the shower and have nothing on their skin and they're like flaring from the hot water of the shower. Or they put like the most basic nothing on their skin and they're just like, I'm itching everywhere. So we have to look at the products. We use the food sensitivities to help guide with the products. But at the same time, eczema is really gut dysbiosis. And so if we were looking at these big major players and I'm like, okay, what's like, how do you treat acne? I'm going to always go hormones, food sensitivities, gut, probably in that order. When I'm treating eczema, I'm like, dysbiosis, number one, food sensitivities, number two, because most of the time they're sensitive to everything, but it's because of the dysbiosis. So
right.
if I have like one test, if they're just like, Dr. DJ, I just need one test, I'm like, you're gonna do a stool test because I gotta figure out what's going on. And we're gonna look at those bugs that are overgrowing and guarantee there's usually one that's related to autoimmune dysfunction that is higher than it should be in someone with eczema.
Interesting. So with eczema, I don't think as much of autoimmune as psoriasis. Tell me more about that.
I see in both. With psoriasis, I will see an autoimmune. You're definitely going to see a bug that's autoimmune related in psoriasis, but I see that also in eczema. But they also in eczema, they're going to have some bug that's like super overgrown. Like it's like ridiculous. Like, why is this random bug? And it could be like Campylobacter. A lot of them will have like parasites, a lot of parasites in eczema, especially eczema that hasn't been able to be treated or controlled with steroids. Because most eczema, even like mild cases of eczema, people like, well, I had some steroids from a dermatologist and then, it went away for like, 8 to 10 years. And then I had this stressful moment. And then now it's like, back, stress. I forgot to mention that stress. Let me restate that. I will probably say stress and eczema because the dysbiosis is going to cause it. But a lot of people with eczema, they have like a lot of stress in their life because you'll see when they argue with their wife, their eczema flares. It's like a cortisol dysfunction. So you'll see that hand in hand. So I'll probably put those together like that cortisol, that adrenal dysfunction, HPA axis dysfunction and dysbiosis probably run hand in hand with eczema. And I definitely will see the autoimmune issue more so in psoriasis, but a lot of times with really severe eczema, you'll see some autoimmune bugs that are there too. And that's a correlation that you see. I can't say that there's a specific bug with each eczema patient, but I'm definitely seeing a lot of the correlation with, bugs being like, whether even if it's streptococcus or something very normal like it's just extremely high and it's been high for a really long time and they're having diarrhea or constipation. There's always some digestive issues that people don't talk about in skin issues. But most patients, I used to say like 99% of patients that come to me with skin issues have dysbiosis. They have some form of either constipation or diarrhea. And so that's like one of my screening questions. So how are your bowel movements? And they're just like, really? Like a lot of people don't even connect that. I'm just like, how are your bowel movements? They're just like, oh, soft serve all the time. Like, yeah, it took you a while, right? It's like soft serve. I just realized that soft serve is a very normal thing to say to describe to me stool. Like no one uses the Bristol. They're just like, it's more like soft serve. And I'm like, oh, got it.
There's DJ the comedian coming out. I love it. Yes, I think that stress part is so important, that gut brain skin connection, and it goes both ways, right? It's the dysbiosis
Yes.
causes the physical stress, which adds to the total stress toll, but then the psychological and emotional stress also leads to additional dysbiosis. So it's just such a
Yes.
vicious cycle.
It
Yeah.
is. There's so many people that come off of all kinds, and I never profess to do this, and I actually don't take people off any type of psych meds. I don't take people off medication in general. I tell their to see their doctors, but their doctors will take them off of things because their mental health gets so much better when you heal their gut. Like people's anxiety is going away, the depression's going away. Because when you deal with people with chronic skin disorder, like it's not just the skin. Like you're dealing with people who like have something on their face and on their body that they cannot hide, and they have to go through their life every day. And you talked about it, like where you were like having acne as a kid. Like think about these kids who like middle school is awful. Like high school is awful. People always talk about you and they're like, look at pizza face. I remember back in the 90s, they would call people pizza face. Like people are dealing with an emotional toil that they're taking because of, what the American Academy of Dermatology said, depression, anxiety, like low self-esteem, like loss of self-worth. Like all of this are symptoms of having acne. Like it's not just the skin issues. And then can you imagine someone with a head to toe eczema, or even steroid withdrawal syndrome? Like there are people that come to see me that have this. And so when I say with Superhero Skincare, I'm like releasing the inner superhero that's inside of them. It's because they've shrunk down to lesser than who they are because of their skin. And their skin is holding them back from being this bubbly, outgoing person because they've shrunk inside of themselves. So it's so much more than just treating the skin. It's about unleashing this inner superhero. And then at the end of that same, like just like in the drug rehab, 30, 60, 90 days, at the end of 4 months, 4 to 6 months, this person is like bubbly and they're just like, oh, Dr. DJ. And they're going out with their friends because they had stopped having a social life. They're like hanging out with their family more. They're laughing where they used to cry in the shower every morning. And they're getting on social media and they're taking pictures and they're doing before and afters and they're helping other people. And so it continuously helps people to understand that skin is so much more than just take this drug and remove this food. It's about healing from the inside out.
Absolutely. I love that you've been able to bring your love of superheroes to your business. I think it's amazing. Let's talk about psoriasis a little bit more. We've talked so much about the acne piece specifically. Can you maybe share what's a little bit different with psoriasis in terms of treatments?
I touched on that a little bit. I think that with psoriasis, it is a little bit of a grab bag of different things because some people with psoriasis, it acts and behaves much like eczema. Sometimes so much that I'm like, have you been diagnosed properly? Why don't you go get a biopsy? Why don't you make sure go get your dermatologist? Let me see that biopsy result because it acts a lot like eczema in some cases. But I'm looking at the microbiome and I'm looking at the foods. And what I've seen with psoriasis personally, and this is just in my clinical practice, is that a lot of the food sensitivities are like more like an intolerance to the food that they cannot ever bring back in versus like most
Mm.
food sensitivities I heal. Like I'll say, okay, you need to remove this one food for 4 to 8 weeks. I've never removed a food longer than 12 weeks, and then we're going to add it back in. And I know you're better because you can eat this food now and it doesn't cause you to have acne or it doesn't cause you to have eczema. Psoriasis is like a grab bag of like, oh, you can never eat that food again because they'll bring it back in and they're just like, yep, got another patch. Oh, got another. I'm like, oh no. Okay. Well, you can't eat eggs. And I've seen eggs be one of the main culprits in psoriasis, like people having like a rando egg allergy that like was undiagnosed. And so a lot of times in psoriasis, I'll need to do like an actual food allergy test because I don't know if they're developing these because of liver toxicity or what, but there's a lot of food allergies, and the number one food implicated that I've seen in psoriasis by research and by clinical like validation is eggs. And so many people have this egg sensitivity that they cannot get rid of. Even if it doesn't pop on their food allergy test, they will eat an egg and they will have a psoriasis lesion. So we will
Wow.
remove that indefinitely.
Let's talk about hair loss. I know we're running out of time here. So, can you? I know this could be another whole episode. So, let's dive into some of the causes of hair loss and then your nutritional and lifestyle approaches. And I know you also have done scalp analysis, but I don't know if you still do that now that you're virtual. Tell me more about that.
Yeah, so with hair loss, I'm going to say like the majority of women that I see with hair loss, because I see some men with hair loss, but the majority of people I see with hair loss are women, and they're coming in with hair loss secondary to iron deficiency anemia
Mm.
that is undiagnosed because people think it's super normal for you to bleed 7 days and it's not on your period. So I feel like that's a hill I'm going to die on. It is not normal for you to bleed 5 to 7 days on your period. And yeah, and I think people and I test. So I just test. I do a CBC, a CMP, and I do an iron panel, and people have low iron, and I fix it, and their hair loss goes away. We do have telogen effluvium, so we do have some people that have hair loss because of stress, but that's going to come back in 3 to 4 months. Mostly, it's 6 months at the most. And we saw a lot of that during 2020, where people were like stressed out and they lost hair, and then it came back. But when you're dealing with hair loss, the number one is usually iron deficiency. And then other forms of hair loss would be stress, and then high androgens, high DHEA, can cause high DHT. Also, like when you look at cortisol, high cortisol levels can cause hair loss. There's several things. It's going to be a hormonal imbalance. Once again, why I do Dutch tests, because we can look at all the hormones and figure out which hormone is out of balance. Same thing with why are you bleeding too much? Why are you bleeding not enough? Why are you spotting on your period? Like when you look at women's medicine and like the abnormalities in the period, the Dutch test is going to give you the most bang for your buck, and also with hair loss as well. So I am looking at the hormones to balance them, as well as looking at the gut, looking at the food sensitivities, but mostly hormones. I will run a Dutch test first in anyone with hair loss. And then we're going to have to start doing an adrenal testing as well, because there are so many people that deal with stress and they think that they're fine. Like people think like people are really running around with like 10 out of 10 stress, and they're just like, "But yeah, I mean, for me, it's like it probably would be this is what they say. This is what they say. It probably would be 10 out of 10 for most people, but for me it's like a 5 or a 6." And I'm like, "Yeah, but your body still feels a 10 out of 10." So, I mean, yeah, like you've mentally changed that in your mind. You're telling yourself that's what it is, but I'm seeing your hair in this bag that you just gave me. And it's all your the thumbs up. Like I see your hair in this bag and it's telling me a different story. Your body feels 10 out of 10. So I feel like with hair loss, we have to look at, all the different things. And when I do a scalp analysis, I am virtual now, so I'm not doing this anymore. But when you look at a scalp, you can actually tell by how the hair strand looks. Like, is it too thin? Is there dimpling or pitting around the hair follicle? There are signs of inflammation that can let you know if it's DHT, if there's inflammation there, and what type of hair loss you're dealing with. So when you look at like when you train in microscopy of the scalp, you'll be able to look at the hair and say, okay, this is because excess androgens versus this is stress related versus this is another reason. Like this is just inflammation, right? Or autoimmune inflammation, which you can see in autoimmune hair disorders as well. You can see that. And that will correlate with their gut stool test. You'll see an autoimmune bug.
Very interesting regarding the scalp analysis. And what you said about stress reminds me of that cartoon, The Dog, where everything's on fire. And the dog's like, everything's
Yeah.
fine. You know what I'm
Everything's fine.
talking about.
That's what most patients with hair loss say. They're like, everything's fine. They're like, I mean, I deal with some stress, but it's probably what the average person deal with. And then they like tell me about the dumpster fire that is their life. And I'm like, do you realize that you're dealing with a lot? And then a lot of times people have this aha moment when I tell them that it's a lot, and it's okay to acknowledge that it's a lot, where they even release in that moment. Because once again, skin, hair, nails, it's it's very stressful and it's a very emotional thing. So when people come to me, the one thing that they're going to say is that, I'm so happy you're listening to me. No one believed me. I knew there was more to this. Or, oh my gosh, thank you for saying that. I didn't realize that I was so stressed and I thought I was supposed to just push through. And they have this like aha moment where they're just like, oh, I'm pushing through. I'm okay. Everything's fine. Everything's fine. And then when they see their labs and they're all out of whack. And then they actually look at pictures of themselves. They're just like, oh, everything's not okay. I am not fine. And then I tell them it's okay and that we're going to get you better in the 4 to 6 months. With hair, it's going to be like 12 months because hair grows slowly. But at the end of the day, that hope is what try to give them. I'm a hope dealer. I'm
You're
a
a
hope dealer.
host.
I give them hope. Actually, that's one of my packages. It's called A New Hope, but it's also
I
after
love
Star
that.
Wars because I'm a big nerd. So it's like a
I
new hope. It's like giving them a new hope that they can be better.
I love that. And with the stress too, again, sometimes it's not just that mental, emotional stress, but because you mentioned 2020, I mean, getting a viral infection is a huge stressor to the body, right? And it's not just COVID, it can be any kind of crazy
Any
stressor
virus.
to the body in terms of an infection, whether it's a
Yeah.
GI infection or a respiratory infection, right?
Yes, all of the stress. So it was the stress of the time
Yeah.
because people were just not used to being isolated, but it also is the stress of the virus. It's also stress of any virus because I have patients that deal with EBV, HSV, any type of virus that lives in the body that can cause your body to be stressed, can cause you to have hair loss, immune dysfunction, hormonal imbalance. It goes back to what is the root cause, right? We're still going back to the root cause. Why are you having these problems? And it's any type of overgrowth of virus. It's any type of bug that's in your system that's not supposed to be there in large amounts.
DJ, I just have one more question for you on hair loss. While you are addressing all of those things, do you also use biotin to help with hair growth?
Yes, I do use biotin. I do use collagen. I do use zinc. I do use amino acids because you need amino acids to have
Yep.
hair. I love me some amino acids. There's all kind of things that you can use for hair, but with hair loss, you also need to look at micronutrient panels. I do run those. I know I talk a lot about stool, food sensitivity, and hormone imbalance, but that's because that's the foundational stuff. And then once I heal, because you have to be able to absorb nutrients, right? And so I want to correct what I can by like letting you eat food, like heal your gut, eat good food, right? But then at the end of the day, we do have to look at a micronutrient panel to see what you have, whether it's a NutriVal or some type of Metabolomix. I love those by Genova. But there's other nutrient panels out there that exist. Uh, any micronutrient panel, just I need to know what's low because most of the time, if you don't have hair, it's because you can't make hair. Like, it's not always something. Sometimes you're just not able to make hair because you don't have the nutrients you need to make hair. And so I need to figure out what that is missing and give it to you. And then there's probably some type of like dysfunction in how you absorb that nutrient to make hair, right? So just that high level picture of it is like, can you make hair? Is there something stopping you from making hair? Are you making hair and then you're just losing it, right? So it's not
Right.
hard. Like naturopathic medicine isn't hard. It's just very intricate details about like how the body works. And I tell my patients all the time, like, you're the person that is going to tell me what's happening in your body. I'm going to translate what your body's telling me. You just take good notes and tell me everything. Like, I need to know what's going on with your poop. I need to know how you feel when you wake up in the morning. I need to know if you had a fight with your spouse or loved one. I need to know all of that. And then I will figure out what to give you to fix it.
I love it. I love it. And I think something I've noticed based on what you just said about the building blocks of collagen and amino acids is there's now this shift in people are talking more about the importance of protein. I mean, we really see that on social media, right? So that's important, but also are we properly absorbing that protein? So those are all things that we can find out with stool testing, metabolomics testing. So Just want to throw that out there, but
Absolutely.
that's important. So, DJ,
Yeah.
thank you so much. This has been so informative. I just have 3 rapid fire questions for you that I ask everybody on the show. But before we go to those, where can people learn more about you?
Well, I am at www.superheroskincare.com, all one word, superheroskincare.com. And at Instagram, it's at Dr. DJ Sims. So DoctorDJ Sims, Dr. DJ Sims. There's only one M in Sims. People still mix, it's one M, and then you can find me. And if you actually just like put in Dr. DJ Naturopath, I should pop up because I don't
Great.
think there's a lot of Dr. DJs.
Great. DJ, what is something that you've changed your mind about through your years in practice?
Ooh, that's a good question. I used to detox everybody immediately. Everybody went on a detox. All of my old students back at SCNM or Sonoran and all my students in Bastyr, Dr. DJ, detox, double detox, everybody. And I stopped doing that because I had like a month of people just reacting to the detox over and over because skin patients are sensitive. So I don't detox anyone until I get the food sensitivity back. And that's the main thing.
What are your 3 favorite supplements just for yourself that you take?
Oh, for myself, collagen. I do take collagen with biotin every day. That's one of your products. I love, oh, what else? I love a SPM. Like I like fish oils, but I love SPMs now. Like SPMs are like the new fad for me because I'm just like, oh, I feel so good when I take a SPM. And there's so many. I love GI Revive, but can I also say that I also love GI Microbe X? I know
Sure.
you said 3. But I like GI Microbe X, and this is not like an everyday thing, but you know, I did my stool test and like that GI Microbe X went in, took care of it. So I was like, how can I not? Physician heal thyself. And I love GI Microbe X and GI Revive. That combination is like chef's kiss.
I love it. I love it. And final question for you. What are your favorite health practices that keep you healthy and resilient and balanced and ready to show up for your patients every day?
Oh, I need to do HIIT. I like HIIT classes because I'm super aggressive. I used to run track, so I need to do something that's like, like 3 days a week. It's going to get me all hyped for the day. That is my caffeine because if not, I have to like artificially have caffeine. And I love me some face mask and like facial, like I'm not a product girl, and which is really like to be in skin, it's really weird to not be a product girl because I love like supplements and internal products. But I do love me a face mask and I love me like a light peel at once a month, like some type of like mandelic acid peel, and then all kind of face masks. I'm a face mask girl, so I got to do my face care routines.
Amazing. I love it. DJ, thank you so very much. This has been such an enlightening conversation, and I so appreciate your wisdom and your humor and just sharing so generously with me today. Thank you.
Thank you so much for having me. This is really fun.
Thank you, DJ. Thank you for tuning in to Conversations for Health. Check out the show notes for any resources from our conversation today. Please share this podcast with your colleagues. Follow, rate, or leave a review wherever you listen or watch. And thank you for designing a well world with us.
This is Conversations for Health with Evelyn Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips.